Hello, everyone. I am Dr. Dream, and you are here for a sub podcast of the It's All Good show. This one is focused on advanced healing tools. And this particular tool that we're focused on today is one that I have firsthand experience with. Many of you know that in September of 2020, I experienced back-to-back strokes. And in addition to the amazing healing assistance that I got from the EE system, the Enhanced Energy Enhancement System that I speak about quite a bit, I was invited to Southern California to try what we're going to be talking about today. And it absolutely was part of a game-changing experience for me. And so when I thought about starting this podcast on advanced healing tools, I thought one of the tools that I want to talk about is the Enhanced External Counterpulsation Therapy Machine. And it's a mouthful. We call it EECP or ECP. Just depends. And there's an expert here in Southern California, and his name is Joseph Yanis, and he's with Applied Cardiac Systems, ACS for short. And he's been involved in this for a long time. I want to welcome you, Joseph, to the It's All Good show. I appreciate you being here.
Yeah, thank you, Dr. Dream. I appreciate the time. So my journey with ECP, it's a kind of a zigzag story, if you will. I traversed across a lot of different scenarios, but so my background is actually electrical engineering. I started with ACS as a young pup back in 1992. I think I was 23 at the time, but I started with the cardiac monitoring development in the research department and developing new ways to record a patient's ECG, specifically for the cardiologist, electrophysiologist, and the hospital settings, medical centers, looking for patients to implant for pacemakers. So about 5-6 years after that, I decided that I wanted to get married, have kids, and I realized that I'm going to need to make a lot more money. So I got into sales. So I jumped on board with the sales manager. I was given the opportunity, brought a whole new aspect to it with my background and being able to really talk the talk and walk the walk. I developed a lot of really good relationships with a very large population of very influential doctors, cardiologists, with a lot of large medical centers. Really quickly, I got into management. I managed a sales team throughout the United States. That grew into more relationships throughout the United States. And in 1998, if my memory serves me well, I started getting a lot of calls from some of my customers, and they started asking questions of what is ECP? Do you guys do ECP? What is this EECP? I started getting questions from a lot of my clients from New York all the way to California. And I started looking into it. And at the time, we were a privately held company. So I had the ear of the CEO, and I asked for permission to maybe research this as an additional product in our sales line. And they said, sure. So I looking into it a little further, we realized really quickly that the company that was involved was really milking, if I can use that term, the industry, because it didn't have to be a $250,000 piece of equipment. It was basically a pump that gates on the R wave of the patient, the heart's rhythm, the patient's rhythms, and it provides a sequential pressure to the lower extremities, assisting the heart in the pumping cycle or the cardiac cycle. So that gained a lot of interest with our engineering team, who I had a good relationship with, the VP or the director of that department, and they developed a product. We rapidly became considered the leader in the industry because a couple of reasons. One, as soon as you remove the doctor from the decision process, Medicare or the insurance companies decide to identify that as a reason to lower the reimbursements. So we knew that going in. So how do we keep the physician involved in the decision process? Well, you develop a report. That the report is looked at and monitored, reviewed, and we patented that report. So when it came to competitive situations, we would say, well, we have the only patented report format, so the physician could stay involved in the decision. Well, we very quickly became the leaders in the industry. We started selling a lot of these beds. Doctors started making a lot of money because the reimbursements were very attractive. And the benefit to the patients is I could very quickly, within 30 minutes of day one, I could show a patient what their plethography graph looked like while having the pressure being applied to the lower extremities. Now, again, this pressure, they look very similar to, and I'm sure Dr. Dreamy have a photo of it, but they look very similar to blood pressure cuffs on the lower extremities, the calves, the thighs, and the hips. And when the heart is at rest, so you have a heartbeat, then this time between you have another heartbeat. Let's say your average is 60 beats per minute. So there's some time between those heartbeats. The device opens up a pump and squeezes the legs at those moments and has the sequential or the milking effect to be able to provide assistance to the heart during rest. So we're preloading, if you will, the heart with fluid or blood that's been sent all the way down to the legs, pushing back up to the heart. And then the heart has now a full vessel, if you will, to then squeeze and pump out a lot of almost 90% of that fluid back to the ventricles, back to the body, back to the lungs. So now you have this cycle that's becoming much more efficient. And when you have that and you're supplying a lot more blood flow, oxygenated blood flow is a key word, to the entire body, including all the organs of the body, you have healing. And in addition to that, you have scenarios where people simply don't exercise anymore, or their body doesn't have the need to have all these collateral vessels anymore, so they become dormant. And that's what we're doing. We're basically increasing the oxygenated blood flow throughout the body, helping people basically wake up their body and all the organs to be able to supply a lot more benefits. And those benefits are quite numerous. I think you probably have a list of them.
Let me ask you, like in the beginning with this, the cardiologist, what was their main focus in using this machine?
Great question. So the number one focus for a lot of cardiologists is they never want to tell the patient, I cannot do anything for you. I am completely out of options. They do not want to tell a patient that you're basically at the end of life. There's nothing I can do. That's what they want to avoid that. The number one killer in the United States today, although you may hear other things, but is still heart attacks. It's heart disease. That's the number one. How do you know? Well, because oftentimes people don't survive their first heart attack. If they do survive their first heart attack, it's only because there's collateral vessels that are still present within that person's body. And they often say that if you survive your second heart attack, chances are you're going to survive your third, your fourth, your fifth, because there's collateral vessels. Well, why is there collateral vessels? Is it that extra mile on the bike ride that they did that day, or is there maybe physical activity for that day, or is it just genetics? We don't know. But what we do know is if we could provide a vehicle for those patients, for people to open up or waken up those hibernating collateral vessels, or those vessels that have fallen asleep, we know we could prevent death at the first heart attack. We now see through nuclear studies, through MRIs, through some of the new technology that we have in imaging that we could see, we know that if there's collateral vessels available, those are going to be the lifesavers of when you have your first heart attack. In addition to that, you have situations where cardiologists they started getting more and more of a population of congestive heart failure patients. Now, CHF patients or congestive heart failure patients, those are your end of the line people. Those are the ones where there's a term called ejection fraction, where the heart is not pushing out, or they're getting at, let's say, 100% of the blood's coming through the upper part of the heart, but only 35% of it is being pushed out of the heart. And then you have a situation where you have claudication, where you have blood clots that form because of the just the circling of this blood that's not being pumped out. And then that's when you have your pulmonary embolism, your strokes, your things like that. So what we need, what the doctors desperately were looking for, is some way to help those patients outside of a heart transplant, outside of any kind of crazy pharmaceutical drug that it's just not there anymore. There was a drug that it's probably still available now that the prescribed patients called, I believe it's Renexa, but that basically just is a band-aid for the symptom of heart disease. And those are the patients that I basically worry about the most, because they don't see it coming. They don't know. They don't have the chest pain. They don't have the symptoms. But there's a lot of physicians that still prescribe that medication. So the progression of disease is significant. And if they had this technology more where it's actually available to people, your average Joe, if you will, you could really start saving lives and really start helping people.
Now, when I was introduced to this, it had nothing to do with my heart. I mean, it always has to do with the heart, but it wasn't a heart patient. I didn't have a cardiologist. It was literally part of a health and wellness protocol. When did that come around? When did it become, like, hey, this can really work for people to, expand their, I mean, it's like a double heartbeat, and it did wonders for me. I'll talk a little bit about my experience, but when did it shift from, like, intense cardiology issues, cardio issues, to now, wait a sec, this can really work for all sorts of other people?
Right. This is my favorite question. I get asked this all the time, and this is one of my favorite questions because, ironically, it was at the beginning of COVID. As I was mentioning, back in the early days of my career, I had a lot of really personal relationships with a lot of these cardiologists and electrophysiologists and high influential people in hospitals and clinics and things like that. And they had the equipment. They bought. If I got to the point where these people just absolutely trusted me, and if I had something that would generate income for their practice and also help them treat their patients and help patients, they would invest in my product. And I to this day I'm just very grateful to them and the benefit of that. But when COVID hit, everyone got really afraid, including myself. I didn't know. Almost 100% of my sales was knocking on doors, talking to doctors, going to lunches, having visits and meetings. And that's what I did. That was my livelihood. If I would travel to meet a rep in New York, it was always going to include a lunch with the physician, a dinner with the physician, some time to get him out of the office, away from his patients, so he can, basically have a good conversation with me. So I developed really close relationships. They had my cell phone. I would FaceTime them all the time, things like that. They started calling me when COVID hit, and they said, Joseph, I don't know what I'm going to do. I cannot, my patients are not allowed to see me. They're not allowed to come to my practice. I have 4 ECP beds here. I've dedicated an entire suite for this therapy. I had over 100 patients a month doing the therapy, having this therapy. And now I'm making $0 and my patients are not allowed to be here. What do I do? And one of the doctors actually mentioned if I could do a consignment program, if I could pick up his bed, bring it back to the corporate facility here in Irvine, California, we could go through it, recertify it, and then sell it as a used bed, if you will, to another doctor or some other clinic. Well, doctors weren't buying anything back then, if you remember. So especially as something where it's designed to have a patient come to the doctor's office and sit down and spend an hour a day, 2 days a week, whatever. So I started looking into it, and crazy enough, I started getting phone calls from people, non-physicians. Well, the very first phone call was a doctor that says, "Hey, I have a patient that asked me if he could buy my bed. I don't want to sell it to him because it's a medical device, a medical thing, and I don't want to be on the hook, if you will." So I started looking into what therapy is. And there's more risk in you getting on an exercise bike or a treadmill at the doctor's office than lying on a bed doing nothing and just being squeezed. So I said, let me look into this a little more. We had some of our people, our clinicians, and they look into it. And says there'd be nothing wrong with us selling it to a normal person for maybe a home application. So of course, my ADD brain went crazy and thinking, wow, I could start selling these to people's homes, and started marketing in that direction. And then this really caught fire with the alternative medicine groups, the alternative medicine people. They started calling me. They started really and then it just caught fire after that. I don't know if you have time for some real life scenarios, but I experienced some crazy situations where I never believed that some people would benefit, because again, I'm meeting with people that are at the end of life. My whole career was cardiac patients, heart transplant patients. How do I stay in the line for a heart transplant long enough to get this transplant? I had one doctor out here in Corona, California, that was a heart transplant candidate. And he bought a bed for himself just to survive the wait list. By the time he came up, and he had that bed for 6 months, in 6 months, we got his ejection fraction back up to normal levels. And in 6 months, when his name was called, they reassessed all his vitals. They did everything again. He was no longer a candidate for heart transplant because ECP healed his heart. It worked. And I have, pre and post, nuclear images where it shows pre-ECP, 35 hours later, post ECP. And it is, I don't know if you're familiar with nuclear studies, but you have dark represents zero oxygen, zero life. Light, or like Christmas lights all over the place, represents oxygenated blood, life. You have dark, and then you had black or white, traces of life everywhere. So that's what we were looking at. And so I mean, I have tons of real life scenarios, Dr. Dream. It's pretty impressive. It's pretty amazing.
I have to tell you, I was invited out to Southern California. I was still didn't feel like I was fully healed from my back-to-back strokes. There were just some things that still didn't quite feel right. And I was invited out here to Southern California, and they said, we want you to try it. And we want you to commit to 30 hours. And I said, great, I'll do it. We brought the RV out here, and we got set up, and I did 30 hours over 40 days. And what I found was, now I'm not a real hardcore exercise person. I mean, I like to bike and this and that. And after my strokes, I was biking, but it wasn't like the biking I was doing before. Mm-hmm. And I went through this process, and I started really biking. I mean, my joke, and you've heard this before. It's like, if you see me running, help me because someone's chasing me, kind of thing. It just wasn't about all the exercise, but biking from the time I was a kid was my favorite thing. And I started biking, and I explain it as I was jonesing for exercise.
Yeah.
So I'm on the ECP 4-5 days, a week, for an hour. Some days I do 2 hours. I mean, I really was going for it, and then take some days off depending on what we were doing, do some side trips and whatnot. But I was like, I couldn't get enough exercise. And for me, this was completely new. Weight dropped off. My stamina, everything was just incredibly expansive. And I was like, this is something. I bought one of the one of the machines. We have it in our place up in Idaho. It's double-edged because last year I spent 2 weeks in Idaho and 11 and a half months on the road. It's not a portable, it's not a portable device.
Right.
But we'll spend more time there this year. And already we've been doing a number of sessions. Stephanie, my wife, has gotten really excellent at the wraps and running everything, and it's really been amazing. Now, some of the things that people talk about are enhanced energy levels, increased productivity, improved quality of life, better cardiovascular health, of course, athletic performance, stress relief, physical well-being, mental well-being, and just proactive health management. Now, this has got to be something that athletes would be very wellness centers that are focused on athletes and bringing them up to their highest potential. I would imagine this would have a tremendous impact in that.
Oh yeah, and that's not recent. That's been going on for athletes for probably the past 20 years. The Lakers, the basketball team utilizes ECP. The San Diego Chargers, almost all the professional teams on the West Coast that I'm aware of utilize ECP. We did a huge study at Scripps down in San Diego for concussion therapy, and they showed that ECP helps with concussions. Which, if you know the mechanism, it makes sense. It makes sense why ECP would work. I think the biggest, I'm just kind of following up on what you just said. So the MMA fighter often will utilize ECP. There's a center down in San Diego, Chula Vista, to be precise. MMA fighters, those guys work out probably 6 to 8 hours a day. I mean, they are grinders. Well, because of just the physical design of our bodies, we have to have a rest in between certain sections. Like if you're doing chest and biceps, you need to rest for a couple of days in order to do the chest and biceps and hit them as hard again. With ECP, you can go right back and doing chest and biceps the very next day. They spend 2 hours on the machine right after their workout, and that basically replenishes all the blood flow, vitalizes all the muscles, heals all the muscles and ligaments and things like that occur during working out, and they can go right back at it the very next day. Some of the Tour de France guys, they utilize ECP for their legs. Sometimes they say that it helps the lactic acid buildup within the legs. I believe that's most likely what's happening, but I also believe, based upon what I've seen in fairly recent years, is that it helps with the muscle recovery and muscle building. You have situations where, these people have never exercised a day in their life, and they're the natural progression of age and disease, reading glasses, hearing, achy bones, achy muscles, things like that, core weakness in your core, getting up out of bed. ECP is people that go into ECP on just a cardiac disease issue. They start seeing the benefits of ECP that are non-cardiac. There's everything from diabetic patients to stroke patients to athletes, like you pointed out. There's the biggest benefit, and what I believe is the biggest benefit to ECP, is that from the very beginning, cardiologists, most of the interventional doctors, can go in and do a stent, can go in and do angioplasty, can go in and basically open up some of those larger vessels. They cannot do anything for the small vessels or microvessels. The symptoms that people have, the benefit that people feel with ECP that are basically not necessarily health related, is we are opening and waking up the dormant microvessels throughout the body. And that's why I often hear people, some of the first things they say is they no longer need their reading glasses, or they hear better, their skin feels better, they can taste, they can smell certain things, because it's all about the microvessels and basically bringing out these healing vehicles within the body that are being woken up by ECP. It's impressive. It is definitely impressive.
It's I swear by it, and so I'm right there with it. Now, let me ask you, who wouldn't be a candidate for this? Are there any particular people dealing with certain challenges that like you wouldn't want to put them on this bed?
Well, some of the obvious ones are going to be, pregnant women, of course. That's some of the obvious ones. Other ones are any kind of intervention, invasive procedure, any surgical procedure that's within 10 weeks. That's something you don't want to do. Something that's gaining a lot of popularity are the, varicose vein injections and things like that. If any of your, clients or people have that within 10 weeks of doing ECP, it's considered a contraindication. Other than that, I mean, again, the genesis of this device was for your congestive heart failure patients. These are the sickest people. And if you could put the sickest population of people on this type of therapy platform, anyone would benefit from this therapy. We've had amputees benefit from ECP. We just, if it's a left leg, we only treat the right leg. I bringing up that topic. I had fairly recently, actually in November of 2024, I had a woman that was her mom had a stroke, a major stroke. She couldn't speak anymore. She couldn't walk. I went the day I delivered I was involved with this because it was literally right around the corner. I delivered the bed. I needed to pick her up, and one of her socks had fallen off. She was wearing socks. So I picked her up. Her socks fell. I noticed her feet were purple. And I started talking to the daughter who was actually my customer. And I said, why are her feet purple? And she's like, well, they're because of the stroke, because of the disease, they're considering amputating below the knee, both feet. And I kind of hit me like, whoa. And again, this is something that was just out beyond what I had no idea. The first thing I thought of was, well, how am I going to put cuffs on the calves? That was my first thought. Second thought was, I don't know if this is going to be a candidate for you. I felt bad because she'd purchased the bed and everything was going, and I discovered this was the scenario. We put the bed in, and her last words to me was on that day was, I bought this bed hoping that we don't have to amputate this patient, my mom's legs, because I'm old. I'm too old to continue to pick her up. I can't pick her up anymore. I need her to get better. So I'm at a interesting enough a pickleball tournament. I get a picture of these two perfect feet. Perfect feet. I think I still have the photograph in my phone. And with no description, nothing. I'm looking, going, who in the heck would send me two perfect feet? These little teeny feet on my phone. So I get a call. I didn't have my phone at the time. I was playing pickleball, of course. And at the end of the day, I looked to see who was the one that texted me the picture, and sure enough, it was the daughter. I called her. I'm like, what is this? I don't understand. It goes, those are my mother's feet. Her life came back to her feet. And the doctor says we don't need to. She's no longer a candidate for amputation. I mean, these are the things that I'm talking about. This was so out of left field that I never would have thought, But sure enough. What's interesting is one of the signs, being in the industry I'm in for so many years, I see a lot of people in their athletic equipment and pickleball courts and things like that. And I see the lower extremities, the swelling, the edema, and the ankles, things like that. And these people, they want to play pickleball. They want to live. They want their life back. So they're doing everything they can. But just stumbling around a pickleball court or a tennis court or going for walks, that's not going to help once the progression of disease is such to where it's there. One of the things ECP that people recognize fairly quickly is weight loss, because the retention of water in the lower extremities and just throughout the body, ECP helps with the kidneys process that extra fluid. So we have people saying, I go to the bathroom more often, my legs feel better, I don't have that tingly pain that I used to. And that's because of the ECP and the kidney function and a lot of the other scenarios that occur. But yeah, there's a lot of outside of the normal that I've experienced, that I've seen, that I've witnessed firsthand. That's pretty impressive.
So let's talk about one other aspect of this. I mean, certainly I consider this a advanced healing device, a therapy machine. I already know the answer, but I'm just going to ask you for your answer here. What does it take to get someone trained, like this woman's daughter, to get her trained on how to facilitate this for her mother or anyone, at a wellness center, what's it take and what level of expertise does
Right.
someone need to have?
Right. So in the beginning of ECP, it required a really high, going back to my story about our patented report format. Um, you know, with my background in cardiac devices and looking at ECG, I had to train cardiac RNs that knew waveform, that knew the ECG, that it's a totally different language. So their experience, their expertise was needed in order to do that. It was heartbreaking when the reimbursement started dropping on the devices I would sell, because a cardiologist could no longer afford to have a $50 an hour or a $65 an hour cardiac nurse to do his interpretations of waveform and run the machine. So we naturally had to kick in our engineers to develop some AI, some technology that would expedite or make it easier for a normal NA, a low level regular person, to be able to get through this Holter report, they called it, to where the reimbursement started making sense again. And doctors, it's a device that doctors need, and they, especially cardiologists, that's what they study. They study waveform. So we took that knowledge in developing the ECP bed, the NCP-1, I believe it was called back then. And we developed it into the NCP-2, and we added that feature of being able to produce a report, an automated report, so that you no longer needed a high level, highly skilled cardiac RN to do the therapy. So when I started doing training with the NCP-2, it was basically about an hour worth of time explaining the most. You had mentioned that your wife has gotten really good at the wraps. The wraps are the most important part. What the wraps are is basically a Velcro. It looks like a blood pressure cuff that you wrap around the leg, make sure it's applied correctly. Then there's 3 electrodes that are basically sticky pads that go on the body. And there's those 3 little sites. You basically you wipe it clean with maybe an alcohol pad, you place the electrode on there, and that's where the machine gets the rhythm or your heart rate to know when to inflate the cuffs and when to deflate the cuffs. So all in all, the majority of time I spend with a regular person, let's say someone off the street, is going to be about an hour to 2 hours. And my main focus is how to wrap the cuffs on these on people, and how to apply those little ECG electrode pads. That's it. You basically push the sequence of buttons, and that turns on the bed. It turns on the timing, and the bed has a lot of safety things that prevent you going in from any kind of risky zones, if you will. So that's pretty much it, and that's been my history of ECP, and being involved in some of the installations and training has been to your average, MA for the most part. When I've been doing this in people's homes, I haven't really been involved that much with them, but I know the training goes really well with those people as well, because they're not cheap, they are expensive, they are a big piece of furniture, and people are interested in providing the therapy themselves. And they take the time to kind of learn to see what's involved. But as far as advanced training, it's really none. There's not really much there.
It's just more to that point, really fascinating. Stephanie had to take a trip, and I literally learned how to do everything myself, to wrap myself and run everything, and look at what I'm supposed to look at, and
Yeah.
the whole thing. I mean, it's that amazing to me that something this powerful, and it's technology, like you say. I mean, it's the ECG. You're hooked up. It's monitoring your heart. You see it, on the machine. There's the pulse or whatever on your finger. There's
Yep.
the whole thing going on, and there's a way that you're looking to have it correlate. I'm not a medical guy, so
Right.
this is why
No,
you're
I know
on
exactly
here.
what you're talking about.
But
Yeah.
to have it correlate that it's in the right zone
Correct.
and everything like that, and anything in my world, I say, hey, if I can do it, anybody can do it, you know? And
Right,
so
right.
it's impressive to me to have something that is such a high level, what I would consider to be a high level of, um, I want to say technology, but then it's like, it, you say it like that, and it's like, well, but that would suggest that it's not able to do exactly what I'm saying. But it's such a high level of healing that's provided and everything that it truly is simple.
Yeah.
And so it's really made a difference for me. Now, we're these days the technology moves so quickly and things are, all sorts of advancements and everything. What's the next level? What's the next step for this technology? Where is it going?
Yeah. So I'm convinced, I'm more convinced now than ever before that ECP and the application of that therapy is going to be right alongside with the Peloton craze. If you're familiar with Peloton, basically, the stationary bike market was, I think, it was popular in the 70s, to be honest with you. But the problem is fairly quickly after buying an exercise bike, it ends up being a garment hanger. People are hanging their clothes on, or they come to dry cleaning, that gets hanging. The things are no longer used. The Peloton craze, however, really that I thought was fascinating. They basically put a giant monitor, just like I'm zooming in on with you right now, with the trainer that's entertaining and gets those people, hey, get off your butt, get on this bike, we're going to go climb a hill. They started with that Peloton model. They started with subscriptions. They started getting people fit. They started competition. They started doing this whole craze. And the COVID thing really popped the cap off this secret. And the secret is the community of this social media world. Because I think where ECP is going, to be honest with you, Dr. Dream, is exactly right there. The only thing that's holding it back right now is the fact that the beds weigh 500 pounds. That's the only thing holding it back. So, since you brought it up, I have an exclusive announcement. We do have the next model of our ECP bed as a portable unit. And the reason why the money's been invested in that is because it doesn't have to be 500 pounds. It does not have to be a all self-contained bed, a twin size bed, if you will. It's designed to roll right into a house, put it right next to your lazy boy, or right next to your dining room table, or right next to your bed that you're used to sleeping in every night. And it uses hoses and bladders and cuffs, just like the new technology. It has a sequential pumping, just like the original technology. And it's really designed for home use. That is the ultimate home use. So where the technology going? Where's the therapy going? I think right there. I think in the very near future, the online, doctor checking in with you over a Zoom call, or the remote assistants telling you what needs to happen here and there and the other, there's nothing for therapy. ECP has already been a proven vehicle to give the therapy. I used to tell this to doctors all the time with, I mentioned earlier, when you remove the physician from the decision process, the first thing Medicare or the FDA wants to do is reduce the reimbursement. That's the first thing they want to do. So what is a cardiac rehab center? Some of us that have gone through cardiac rehab or, invasive procedures because of cardiac disease, a doctor will write a prescription. Okay, I'm going to give you 30 days of cardiac rehab. The failure rate for patients to go into a cardiac rehab is almost 90%. No one goes. The reason why they don't go, the reason why they don't follow up with it, it's not because they want to feel better. It's not because they want to get better. It's because the physician isn't involved. The doctor's not getting a reimbursement every time he writes a prescription to send the patient to his cardiac rehab. The last thing a patient wants to do is get on an exercise bike or a treadmill or do something that's going to cause this crazy chest pain or pain that they had that caused the heart attack in the first place. What they're going to do is they're going to go home, they're going to watch TV, and they're going to have the remote in their hand, and they're going to go on living until the disease takes them over again. Because it's a proven fact that within 6 months of a percutaneous or a surgical procedure for heart disease, like a cath, a stent, or bypass, within 6 months, that patient is of the same exact classification or worse. Why is that? Because cardiac rehab or cardiac therapy is a huge failure to the medical world. It is. And there's a lot of hospitals that don't even provide it anymore. So where does ECP go in the near future? It goes right into people's homes. That's where I see it going. And where does cardiac therapy end up going? It's going to go into a mobile unit, just like the system I described to you, where it's a portable, where they come in, they drop off a machine, and you run it for however long it takes. But I do believe that's where it's going to go. What I'm trying to do with giving this, being so grateful and allowing me to be on your podcast today, Dr. Dream, is I want to get this out there so people know that they can have this therapy. They can have this healing, life-saving machine without having to go through the cardiac and the heart attacks and the strokes and all that. We have the world of the future is prevention. That's where I think it is. And I think of course, exercise and diet are right there, but most people today need that bump. They need that help. They need that leg up. ECP is that leg up. And you have your Peloton people. They don't use a Peloton once for 30 days. Peloton becomes that exercise bike, that Peloton program becomes a yearly subscription. That's something that they do every single hour, whether it's before work, after work, or their lunch break. They do it every single day. ECP is exactly the same thing. It's the same exact thing. It becomes a lifestyle change, like you pointed out. It's something you do every single day. Just do it every day. And that's what it turns into.
I really appreciate all of this information. I've known you for a couple of years now, and I didn't really know your background and your story, and you have, I mean, from what I can tell, been really instrumental in helping change a lot of people's lives, and I'm on that list, and so I'm
Wonderful.
tremendously grateful for you. I love hearing that people like myself and incredibly more challenged
Oh, yeah.
are able to get this into their home. I love seeing that these are getting into health and wellness centers and becoming more well known, more accepted, more understood out in the general public. It makes a huge difference, and I just want to thank you for being on the show today. Just before we end, is there anything we didn't touch on, or anything else that you want to add?
No, I'm just really excited. This new type of medicine, this new type of direction in the alternative medicine world is very, very exciting, and I see it as the next level. And I think the only thing I would add is I think COVID and the ridiculousness of everything that has occurred with COVID and surrounding COVID has really probably not gone as planned for the pharmaceutical companies, because I believe ECP is definitely reducing the amount of prescriptions that people are getting, because it really truly is helping people and saving people outside of the side effects of a lot of the prescription drugs that people have just been blindly taking and not realizing the restrictions of a lifestyle that they had, just because they have to take this new medication, whether it's a blood thinner or a blood pressure medication. I'm 55 years old. I'm very, very healthy. I've done sports. I played beach volleyball. I've done everything for years. And because I turned 55, the first thing my doctor wanted to prescribe me was a blood pressure medication, a cholesterol medication, and some statin. And with my history, I said, no, I'll fix it, whatever. I just started exercising a little more, maybe changing my diet a little more. And I fit in all normal ranges, and I'm totally fine. I have no side effects of any pharmaceutical medication that I was prescribed for just the reason of being 50 or 55. So yeah, that's what I want for everyone. I want people to really start reaching for a lot more and not just taking, blindly what their, physicians say. I often joke, especially with my parents, that the senior citizen of today is far more knowledgeable than they were 20, 25 years ago. And that's 100% because of situations like you, Dr. Dream, these podcasts, social media, Instagram, Facebook. The truth is getting out there, and I really appreciate you inviting me for the show. I'm proud to be part of it. Thank you.
Joseph, thank you very much. I look forward to continued contact with you and getting more of these machines out there and really changing the quality of people's lives as it's done for me. Thank you for being on the It's All Good show, and we'll be in touch.
Okay, take care. Thank you, sir.